how you see it show up in people's lives. I know that you tend to get things like a trauma surgeon would see the human body, hemorrhaging and in need of great support. But how do you think about addiction?
First, I'd like to make a little bit of a distinction. We're going to talk about addiction. When we look at the DSM, the diagnostic manual that we use for diagnosing psychological disorders, not really addiction as a diagnosis. That's not super important necessarily because we can talk about it in the term of addiction. But we can look at people and look at biological, psychological, and social factors and make a diagnosis to see that they've got a substance use disorder, an alcohol use disorder, whether it's moderate or severe, or they're dependent on it. And not to give people an out, but not all people that show up with an alcohol use disorder for a point in time are necessarily an addict. They may not be forever. It might have been a life circumstance that brought them there. That said, someone that at a point in time in their life could have an alcohol use disorder or a substance use disorder, they're probably prone to that, and they probably shouldn't continue down that path or gamble